I think it's important that we always look at what's going on in Raleigh and with our elected officials. And recently you may have seen the Treasurer has taken a number of significant actions against the hospitals, which include our nurses and our technicians and our people that clean the rooms and help us take care of Eastern North Carolina. And his actions and his words have been communicated pretty broadly by him, and there have been few people that have been talking about the other story, which is the story of taking care of Eastern North Carolina and understanding the environment that we live in. So the type of cuts that he is proposing to the hospitals and to the doctors will play out differently here. And we all know this in Eastern North Carolina because we always have to fight for the needs of our communities, and it seems often that those needs are forgotten on the other side of I-95 and outside of Eastern North Carolina. So the cuts that he's talking about in the state health plan will affect Vidant Health at $40 million and affect many of the physicians in Eastern North Carolina that are important for us to fulfill our mission. And I've tried to explain to the Treasurer, but I want to explain to you that those cuts will have significant impact and will be felt in rural North Carolina and specifically in Eastern North Carolina more severely and more significantly than they are in other parts of the state. And so cutting health care for our communities who struggle every day to recruit new businesses and to increase economic opportunity is not the right answer for Eastern North Carolina. And so I encourage you to learn about these cuts. We're going to work very hard to continue our mission, which is to improve the health and well-being of Eastern North Carolina. And we feel that there are more rational, reasonable, and mature actions to control healthcare costs. And we've demonstrated that at Vidant Health. And we ask you to learn about those things and to understand that we are advocating for improving our communities and making sure our communities are not left behind again.